the silent killer doesn't discriminate. It's happening to you and you and you and everybody else too, so you're kind of like excited to have a platform to talk to you guys about something that means a lot to me, the whole more than a number brand, the message and the movement, and that's what we're going to be talking about this morning. Let me just tell you the reasons that I'm actually here. Number one, silent killer. You know, it's a weird idea, but it's a real one. And this is the thing you got to understand. And you've experienced it. You probably didn't label it yet as a silent killer, but I'll explain that to you and take you through that. I'm going to go through, a lot of impact experiences, and I'll tell you what that is. I mean, this is basically a moment in time where something happened to you that you can't forget, you won't forget it. And then it affects you, your entire life. And a lot of times subconsciously, you don't even know it's doing it. But then you wake up and realize that happened to me when I was 6 years old, and it still carried it with me. And every day I talk to so-and-so, it comes out. That's an impact experience that you guys have all had. We'll move on to the silent killer message. Then I'll hit on more than a number. And then we'll talk about the escapes. In terms of what do you do, when the silent killers got you? How do you escape? And there's two ways to do that. I'm going to talk through that at the end. So let me talk about the silent killer. Think of this thing as like the chronic disease of the healthcare profession, right? It's kind of like uncontrolled hypertension. You don't even know it's there. Then the STEMI happens, the stroke happens, you rupture an aneurysm. The silent killer, it's happening so slowly and quietly, like we don't even know it's there until you can't get away from it. And so I'll set this up kind of like a trip down memory lane for you guys. Go back to when you guys were pre-health. There's always somebody that you looked up to, like as a mentor, a doctor, a nurse, a family member in the field. You would look at them, like I did this. You would look at them and you would just idolize those people. You wanted to be like them. And you'd have these experiences with them clinically, and you'd be like, man, I cannot wait until I get through the training and get the education. And I can be that person. It seems like dream come true for you. You guys have all been there. That's how I lived. The truth is you're right now probably doing exactly what you had hoped and dreamed you would be doing. But then kind of the dark part is okay, you were so driven to do all this stuff, right? You sacrificed your time, family, friends, money, your health. I used to study 90 hours a week because I was a stupid jock and didn't know how to read practically when I got to college. Mom remembers that. So you sacrificed so much, is my point, to get here. And the sad part is sometimes you get stuck in these ruts and you didn't even know you were there or how you got there, but it's that same passion, and we'll call it like a pop, that you thought you'd be getting out of what you do every day, it's gone, right? When you wanted to do this to impact people, change lives, and save lives, and sometimes you just realize it doesn't seem to matter so much anymore. But so here's the point. I'm going to keep circling back to the point. So, I hope you guys have not been there. But I've talked to most people in this room and another 1,000 people in healthcare, and I know you guys have. Hopefully you're not there now, but someday you might. And so the question you got to ask then is where the hell did this come from? How did this happen to me? I didn't just all of a sudden wake up someday and feel like this. How did we get here? And so let me tell you what happens. Again, this is my experience, 15 years in medicine, 9 different hospitals. It's these impact experiences. And of course, I've had my moments, great moments. I literally can't wait to get out of the hospital, call somebody, call my parents, call my fiance, call my friends, call my colleagues from, training, and just be like, look, this is what happened with this nasty GI bleed and blah, blah, blah. It was so exciting, right? But then the problem is what happens is you actually end up having more of the opposite, where the experiences aren't so good. So then we got to ask ourselves, what are they? What is the root cause of the silent killer, right? And it's not patience. I mean, honestly, like, we're ER staff. Like, we know there's certain days where people come in and they drive you nuts and you really wish you could help them, genuinely, but you can't. You know, it drives you crazy. But again, drawing on my experience, 15 years, 9 hospitals, and it's like you end up having too many of the bad experiences, and they're not patient care related. And so here's the message I've shared, and people are always like, you know, damn, man, like, I think you're right, but like, I'm not going to say that. I don't want anybody quoting me. I don't want that on paper. But that's fine. Like, I will put it on paper, and here's the reality. Here's the reality of this in my experience is the bad ones come from administration and leadership. All right, nobody wants to agree, technically, formally, publicly, but it's true. And so the next question then is like, okay, well, if that's true, Dave, like what are they doing? Like, what's happening to you? And so, I mean, I could go on and on about ones I've had 15 years where, you know, you talk about a pop and it's like, I mean, I get a lot of pops, but it's like punch right in the face. I mean, those are the pops I've experienced a lot. So just put it under a big umbrella then and say, these are the things. You guys ask yourself if you can relate. So it's feeling unsupported, undervalued, underappreciated, taken advantage of. Like, and trust me, this isn't like a weekly nurse manager email telling you like these are things we feel about you, but this is the message, unfortunately, that a lot of times we get is healthcare. And like, put it in perspective quick, and you guys, maybe this is dramatic, but it's not, it's real. And pretend you go into a counselor's office and you're trying to explain to them what's going on in your life, and you pick even like 2 or 3 of those phrases, like, well, I feel unappreciated and taken advantage of, undervalued. And then just like kick it back, put your feet up on the table and be like, all right, doc, whatever, counselor, like, what's happening to me? Like, what is this? You know? And they're gonna say the same thing in like 2 seconds. They'll be like, well, Dave, that sounds like an abusive relationship. So then what? Well, it's like, okay, well, go back to healthcare. So what do we do? I mean, it's the same as anybody that's being abused. It's like you have 2 options, right? You either leave. You know, I've had great friends go through the whole thing with medical school, residency, blah, 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 and they just leave medicine. Honestly, you guys know them. It happens. But the other option you have is you just have to adapt. You have to adapt to it. You know, it's the only way you can, quote unquote, survive. If you're going to stay, you got to adapt. And so what does that look like in healthcare? How do we adapt to something like that? Protect your health, mental and physical. And so what you do is you adopt what I've termed as the clock in, clock out mentality. You guys know what I mean, but here's how it worked for me. I'm gonna be here 3 minutes before my shift, or probably 10 minutes after it starts. But in my head, I was gonna be early. And then when 45 minutes before my shift rolls around, like, bro, like I'm dialing it back. Like, I'm not seeing patients. I'm just putting my feet up, clicking boxes, and as soon as the clock strikes, I mean, like, I'm out the door. I mean, if I have any friends at that hospital, I might hang out and chat a little bit, but I'm not working after I'm done. And that's clock in, clock out mentality, and we've had to do that. You know, I don't think we start that way, but it's like you have enough experiences where you bend over backwards, you give more than is expected, and then the tables turn and it's like the response is kind of like, we'll take it or leave it, man. Like, we didn't really technically force you to do that, so it's on you. So you get that clock in, clock out mentality. It happens. And so peeling back another layer, guys. Let's go one more layer. We got about 2 more layers. I'll move it on, but how do you get there then? Like, I don't think you show up for orientation and like they tell you that this is how it's going to be, and then all of a sudden you go a couple months, years down the road, and it is how it is. Like, how in the hell does that happen? And that one's easy too. I mean, it's you're conditioned for it because the silent killer doesn't discriminate. In other words, everybody feels it. So you're going through this and you're feeling disrespected, taken advantage of, blah, blah, blah. But like, it's happening to you and you and you and everybody else too. So you're kind of like, okay, I guess I shouldn't get too excited. This is just how it is. And for all I know, it's like this everywhere. So then you just accept it. You get the clock in, clock out mentality. Going back to the things that put you in medicine in the first place, and like that excitement, that drive, that passion, and we'll call that like the pop. Like that's the pop that you get out of this. The thing that makes you wake up early, excited to go to work, do your job, can't wait to do it again the next day. I mean, that's the pop that we all went into this for and that we need to recapture. And that's my point, because we're getting to this level now with the silent killer and the clock in, clock out mentality where there's no pop. And that's depressing. So then let's switch gears. What do we do about it? Like that was the darkest part of this whole thing, guys. I'm not going to sit up here and cry like this all day, but so what do we do about it? And how do we fight back? And again, that's either leave or you got to adapt. And so we're going to move on and talk about more than a number. And eventually circle it back, because this is how you fight back. It's the more than a number principles. We're going to talk through those. And so